Extract 1. Questions 1 to 12. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. What brings you here?
Good morning, Nurse Stroll. I've been feeling really off lately. I've had this persistent headache for weeks now. It's been getting worse, and I'm starting to worry that it could be something serious. It's like this dull, aching pain that never really goes away, but sometimes it gets sharper, especially towards the end of the day. I feel tense all the time.
I see. Mihiraa, can you describe the headache a bit more?
Well, it started about a month ago. At first, I thought it was just stress, but it hasn't gone away. The pain is mostly around the temples and across my forehead. Sometimes it feels like there's pressure, like a tight band is squeezing my head. It's usually worse in the afternoon or evening. It's not a throbbing pain like a migraine, but it's enough to make it hard to focus on anything. I also feel this stiffness in my neck and shoulders. But I have been feeling really tired lately. Even when I sleep, I don't wake up feeling rested. I thought maybe it had something to do with my sleep, but I'm not sure anymore. I'm also finding it hard to relax, like my muscles are constantly tensed up.
Mihiraa, have you had headaches like this before, or is this the first time it's been persistent?
I've had headaches here and there, but nothing like this. This one has been going on for about 4 weeks, and it's getting harder to manage. I've tried taking some over-the-counter painkillers, like ibuprofen and paracetamol, but they don't seem to help much. I even tried a muscle relaxant my friend recommended, something called methocarbamol, but that didn't really do much either. I've been drinking more water, thinking it might be dehydration. I've tried meditating and doing some deep breathing exercises too, but nothing seems to really stop the pain. I've also tried applying heat packs to my neck and shoulders, which helps a little, but it doesn't get rid of the headache.
Thanks for sharing that, Mihiraa. And do you have any family history of similar conditions?
My mother used to get migraines pretty frequently when she was younger, but they stopped as she got older. No one else in my family has had any similar issues, though.
Okay, Mihiraa. Based on what you've told me, it sounds like you may be experiencing a tension headache. These are typically caused by muscle tension, often related to stress, poor posture, or lack of proper rest.
Is that something serious?
They are quite common, Mihiraa, and while they can be very uncomfortable, they're usually not a sign of something more serious. It's often related to muscle strain, especially in the neck and shoulders, which matches your symptoms.
Oh, that's a relief to hear. So what can I do to get rid of it?
There are a few things we can try. First, we'll focus on managing the muscle tension. You might benefit from a combination of techniques, that is, regular stretching exercises, especially for your neck and shoulders, and relaxation techniques like meditation or deep breathing. If you spend a lot of time at a desk, making sure your posture is correct can help too. For medication, ibuprofen or paracetamol can still be used, but it's important not to overuse them. Taking them sparingly can prevent rebound headaches. I would also recommend considering something like amitriptyline, which is sometimes prescribed in low doses for chronic tension headaches. It helps relax the muscles and improve sleep quality.
Okay, that makes sense. Thank you, Nurse Stroll.
You're welcome, Mihiraa.
Extract 2. Questions 13 to 24. You hear a dermatologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good afternoon, Mihiraa. How can I assist you today?
Good afternoon, Dr. Thame. I've been really worried about my skin lately, especially my face. Over the past year, I've noticed more and more wrinkles developing around my eyes, forehead, and even my mouth. It feels like they've appeared suddenly, and it's really affecting my confidence. I used to have smooth skin, but now it's starting to sag. I know aging is a part of life, but I didn't expect it to happen so fast. I've tried different creams, but nothing seems to be helping.
I understand. This can be a concern for many, and they can appear more prominently for different reasons. Can you describe your symptoms in more detail?
Sure. So, about a year ago, I started noticing fine lines around my eyes, especially when I smiled. At first, I thought they were just smile lines, but then they started deepening. Now, I have crow's feet, and the skin around my eyes looks thinner. My forehead lines are becoming more pronounced, especially when I raise my eyebrows, and the lines around my mouth make me look tired. I've also noticed that my skin has become drier and less elastic. It's like it's losing its firmness and plumpness, almost like the collagen is disappearing.
I see. Mihiraa, have you experienced any other changes in your skin's texture or tone?
Yes, actually. I've noticed that my skin gets redder and more sensitive after spending time outdoors. I've always had darker skin, but now there are some patches that look dull, and I can see discoloration in some areas. My skin doesn't feel as smooth as it used to either. It's a bit rough and dry no matter how much I moisturize.
Understood. Let's talk about your skincare routine and any treatments you've tried. Are there any specific products you've been using or medications you've taken for this issue, Mihiraa?
Well, I've tried a bunch of over-the-counter anti-wrinkle creams, mostly ones with retinol, since I heard that's supposed to help. I've been using it for about 3 months now, but it hasn't made much of a difference. Before that, I used a vitamin C serum for 6 months, but I didn't notice much improvement. I've also tried hyaluronic acid serums to boost hydration. Aside from that, I've just been using a regular moisturizer and sunscreen. I haven't taken any prescription medications for my skin.
How long have you been consistently using the sunscreen?
I've been using sunscreen regularly for about 2 years now. It's an SPF 30, but I apply it only once in the morning. I wasn't as diligent about it before, especially when I was younger.
Thank you for that information. Now, do you have any prior treatments or conditions related to your skin, Mihiraa?
Not really. I haven't had any major skin conditions in the past, and I haven't been on any long-term medications.
And what about your family history?
My mother had these when she was in her 50s, but nothing like what I'm experiencing now. My father's skin aged pretty well, though. No one in my family has had any major skin problems that I know of.
Thanks for sharing that, Mihiraa. I'm starting to see a clearer picture. It seems like the main issue here is the premature appearance of wrinkles. Factors like sun exposure, skin hydration, and collagen depletion are likely playing a role. Based on what you've told me, and after examining your skin, it appears that you're dealing with a combination of intrinsic aging and photoaging, which is aging accelerated by sun exposure.
So what can I do about it? Is there any treatment that will actually help?
There are a few treatment options we can explore. We could consider prescribing a stronger retinoid. Additionally, we could consider in-office treatments such as chemical peels or microneedling, both of which can help rejuvenate the skin and reduce the appearance of fine lines. For deeper wrinkles, you might benefit from injectable treatments like botulinum toxin for dynamic wrinkles, especially on your forehead and around your eyes.
That sounds like a lot of options. Thank you, Dr. Thame. I feel more hopeful about managing these wrinkles now.
You're welcome, Mihiraa.